Hello, thank you for joining me today. It's good to see everybody in a different way this time as far as how we usually do our meetings. Usually we're at the hotel and there's many people and it's good to see everybody. So this time we're in a little different situation, and I've had many calls about when the meetings are going to be, and unfortunately there are not going to be any meetings this year because of the coronavirus situation, and I'm hoping that everybody is managing through that. And I wanted to first introduce the new logo. Everybody's gotten a mailing on it that was a client last couple years, but the newer clients obviously may not have gotten it, but you got it in person in your business card. Ultimately today we're going to talk about the Aetna programs, and we're doing it this way because obviously the coronavirus has allowed us to not be able to meet at the hotels like we normally do. So I want to thank you for joining me, and we're going to get right to it. Let's talk about the Aetna programs, Aetna Medicare Advantage specifically. We're going to talk about their HMOs and PPOs. I'm going to distinguish the differences. And some of you have been members for a very long time, and I've worked with you over the years, and it's been a very good product for you. Some of you have changed plans from year to year, and that's kind of why we're here today. We want to determine, do we keep our current plan or do we move to something else? So that being said, I think we should talk through some of the details. So today I'm going to cover some very specific things. We're going to overview what Medicare Advantage is. We're going to talk about how the benefits work and how you're going to take advantage of them, go over the costs and some of the additional information, and most specifically the changes for 2021. I'm going to be general for the most part, but I will point out some specific things as well. So let's talk about basic Medicare. Most of you are familiar with this, but I'm just going to do a real quick overview. We have different parts of the program. We have Part A, hospital benefits, Part B, medical. We have the Part D, the drug benefit, and you can see as I'm going around the circle. And then there's the extra benefits that a lot of these programs have, like the gym membership, vision, dental, hearing. Those are all part of the program that we're going to be looking at today. There is one particular program that does not have a drug benefit, but that's specifically designed for a certain population. And if you have that situation, we'll talk about it when we have our meetings. So there is a website that you have access to, and I've found that some people use it very frequently. You can do a lot on that website. You can look at your ID card, you can look at the explanation of benefits, you can look at the claims data. So it's at your access. You can see on the screen there's some other things that are available to you, and it's very useful. Okay, so now we're going to look at how do we find certain things, and there's different ways. You can use the website, and you can see there's references to the website on the pharmacy directory and the provider directory. There's also a couple 800 numbers that you can use for customer service. Actually, it's only one 800 number, but it's twice. If you have questions about the formulary or the specific benefits, you can call the 800 number. In addition to that, I'm always available. I don't want you to think that you can't call me to talk to me about certain things, and I actually want you to do that. As things become challenging for you, or if you have questions about how your coverage is going to work, please don't hesitate to call me. That's very important. This next slide is about the ID card. Everybody has the ID card. It has all the pertinent information on it. You'll get a new ID card starting probably sometime in December, and it'll actually go into effect January 1. Let's talk about the drug benefit, Part D. That's a very important thing for most people. What I'll tell you is it does impact some decision making, but in general, all the plans are very similar. There's some important terms that you're going to need to know about the drug benefit that you should be familiar with. The formulary is basically the list of drugs. The tiering of the drugs, the drug tiers, there's 5 tiers. So the more expensive the drug, the higher the tier. And they're classified by the insurance company in different ways. Sometimes the generic drug may be a tier 4, so you just have to be careful when you're looking at your prescriptions. Make sure that you have the right tier, because it translates into the cost you're going to pay. Network pharmacies and transition process is pretty self-explanatory, and if you do have specific questions on those, we can certainly talk about that in the future. So let's talk about the specific drug coverage. There's 4 stages. For the Aetna programs, you're only going to have to deal with 3 of the stages because stage 1 in this example does not exist. None of their drug programs have a deductible. The second stage, the initial coverage, you're just going to pay co-pays based upon the tier of the drug. And that'll be dictated by the certain plan that you're looking at. So we have the third stage is when you exceed the actual allowance of the $4,130. What happens here is that's the actual cost of the drug. You have to be very careful about that. Some people misunderstand that. So it's not your copay, it's the actual cost of the drug. And this stage is actually called the donut hole or the coverage gap. And what's going to happen is you will continue to pay a percentage of your drug in the donut hole until you get the $6,500 out of your pocket, which is a considerable amount of money. The good news is most people that I'm dealing with don't have that concern, but if you do have the concern, I'll tell people, there's things that we can do. I'll give you maybe some things that you might want to try. Talk to your doctor, go to the manufacturer, go to the pharmacy. There might be ways that they can work with you to get the price down a little bit when you're in the donut hole. For that matter, even if before you get in the donut hole, you might want to investigate those options. Stage 4, the catastrophic stage, basically what that means is you're going to pay much less for your medication, no more than 5% of the Medicare agreed upon price. Okay, so the pharmacies that you can go to, there's a wide range of pharmacies. You just need to make sure that you know the difference between a preferred pharmacy and a standard. The preferred network is a little more limited, but you get better pricing. So you do want to, my recommendation is that you always go to the preferred pharmacy. There are national networks, so if you're traveling and you need a prescription, a lot of times you can go to a major pharmacy like a Walmart and get it filled. And this is just reviewing the list of preferred pharmacies. You can see here that some of them you may recognize, others not, because they're all over the country. Also, there's mail order available. It's a very good program. The prescription comes right to your door, and it's very convenient. I find a lot of the clients like that. So here's some of the specific rules that might come into play for you with the drug coverage, depending on what's going on and what your medication is. You may need prior authorization. Certain drugs that are high potency, so to speak, or have side effects that might be of concern. The doctor will actually need to authorize them for the pharmacy to fill them. And it may also limit, it might be a 30-day supply instead of a 90-day supply. And that's part of the next the quantity limit issue is a lot of times the drugs are limited based upon either cost or the side effects that they're concerned with. Step therapy is a situation that when the doctor prescribes a drug, he may want to start at a lower level drug and gradually might need to ramp you up to something that's higher potency, so to speak. So let's talk a little bit more about the formulary. The main thing is when you're looking at the formulary, looking at the drugs, verify before you get your medication filled, you want to verify what tier it is so that you know. I don't want you to have a surprise when you show up to the pharmacy and find out the drug's $100 and you expected to pay $15, and that's never good. And that's a lot of times you want to talk to your doctor about that. Make sure that he knows before he prescribes a drug whether it in fact is even in the formulary. And obviously you have a cost factor that you want to talk to him about, and maybe you want to start with the generic if you can, if it's available. If you're finding that your drug costs are very expensive and you're having some trouble meeting those costs, there is a program available through the federal government. It's called Extra Help. It's income-based, but what I would recommend you do is you find out if you qualify for that, and there's an 800 number right there on the screen that you can call and basically find out if your income qualifies you for that Extra Help program. You can also call Social Security. They'll also have that information available for you. So all these plans are designed that you choose your own PCP. You do not have to, but I certainly recommend that you choose the PCP because the PCP will actually be right on your card and it will help you be identified as a patient when you go to the doctor's office. Your PCP is designed basically to treat basic illnesses and give you medical advice, and it will coordinate your care with your specialists. And that's the main reason you want the PCP. You basically want somebody helping you coordinate all of your care and helping you through the process as you're using the medical care. So let's just talk a little bit about the levels. So the PCP, like I said, is the first line, let's call them the first line of defense. But if something's happening and it's not during regular business hours, you might need to go to a walk-in clinic or urgent care center. Or if it's very serious, you're going to want to go to the emergency room. So that's the hierarchy. Obviously, you try to go to your PCP first, and then maybe he'll recommend a specialist. Or if something's very serious, he's going to send you right to the ER. So that's kind of the hierarchy. And if you're not sure where to go, you can call the nurse advice hotline, and they're very helpful as well. Sometimes, based upon calling them, they may tell you you don't have to go anywhere, and they might walk you through some symptoms. You will be talking to an RN that's highly trained to help talk you through the health situations that you're dealing with. Another thing that people always ask me about is, I get one free visit every year. Well, that's called a wellness visit, and you're going to want to do that. There's no cost for that wellness visit at your PCP, but it's a very low-level visit. It's very basic. They'll probably take your height, weight, just some minor, maybe talk to you a little bit about your diet, and that's really about it. They're not going to get into a lot of detail. It's not a physical. When you do have your physical exam, your annual routine exam, that's when they're going to get into more detail about your specific health, talk about your medication, and make recommendations. Maybe even have you go to a specialist at that point in time based upon what you're talking about. In addition to that, Aetna offers an in-home home assessment. There's a third-party company that will be calling you to set that up. Ultimately, it's a good program. I do want you to take advantage of it. They'll come to your home. It's very non-intrusive. It probably takes about a half hour to 45 minutes. They'll ask you some basic questions, talk through some things, review your medical history, and if they find anything significant, for example, I've had situations where they've come and seen elevated blood pressure. If they find that, they're going to say, you know what, your blood pressure is a little bit high. Are you realizing that, are you on any medication for that? And if you say no, they're going to say, well, if it's all right with you, I'd like to pass this information on to your PCP. It's for your best interest to do that, because obviously that's something that needs to be reviewed by your doctor. So one of the things Aetna does, I think, very well is look at the situation currently, and they've realized that because of the COVID-19 virus, anything associated to that they're going to take care of that for you the best they can, and you're not going to have to worry about a lot of cost associated with it. There's an extra benefit package they put together to take care of that. It includes actually telemedicine, so you don't even have to go to the doctor. You can do a video appointment, so to speak. It's very helpful. It does eliminate the concern that people may have when they're going out and about and maybe exposing themselves in a doctor's office to some unnecessary germs and things like that. In addition to that, you still can have the regular office visit if you would like, but that's certainly your call. 24-hour nurse line, I talked about that a little bit earlier. It's very good, helpful. I find that if a lot of people are telling me that, in the middle of the night, if something happens, they don't feel well, they just pick up the phone and call the number and get some direction, and it's very helpful. I mentioned a little bit about the virtual doctor's visits, and they, in fact, can be a time saver for everybody, but that's not the main reason you want to do it. It's more out of protection to keep you out of the environment that might present more germs to you and maybe harm you needlessly. It happens over the phone. You can use a smartphone. You can use a computer. You can just use neither one of those and just talk to the doctor. So another benefit that I find a segment of the people that I work with like is the silver sneakers. It becomes a social benefit. They see their friends there. They do different things. They go to a class. You have the ability to go to a multitude of gyms that accept silver sneakers, and it's the insurance company covers the cost. I have been told that it's been much more difficult during this time, and it's not as popular because people just aren't seeming to meet at the gym as much. It's only natural. Okay, in addition, there's another program called Resources for Living program. It can help It's basically just a way you can call and get a referral for services that you may need to help you through your home and even personal things, maybe even transportation. It's a benefit that's, the way I call it, it's kind of a helping hand benefit is the best way to call it. And they're there, you call the 800 number, they'll give you some recommendations, there's no cost for it, and the consultant that you talk to on the phone will try to help you as much as they can. It is something that I found is, I've gotten good feedback from it. Okay, this is something new that Aetna's come out with, and actually I should say, remind everybody that CVS actually owns Aetna, and they bought Aetna probably almost 2 years ago now, maybe a little longer than that, I can't exactly remember. But based upon that partnership, they've come out with this, they're calling it an extra care health card. The discount card will allow you to go into the stores and basically use it on CVS branded items, and I think it's going to be a very good, valuable tool for people to save money on things that you're buying anyways. So you can also, what will happen is you'll get the card with your packet for next year, and you'll have to call to activate the card to get the benefits to start. So Aetna prides himself in taking a total approach to their health care. What that means, a lot of times, I think I said it last year, in my opinion, what they do is they take a look at the health, not only your body, your physical needs, but also your mental needs, and they offer certain things to just, might be a pick-me-up and things like that on some of the benefits. Some of you should have gotten, in fact, I think most of you got a purple box in the mail over the last couple weeks. And there were some things in there. I actually saw one the other day when I was at a client's house. And there were some very unique things. There was some toothpaste and things like that. But then there was a little, I didn't know what it was, but it was a pill cutter. Cut your pill in half if you need to do that. So there was some little trinkets in there that I felt it was a very nice gesture from the insurance company saying, hey, we appreciate your business and we want to send you a little bit of a gift. Okay, now what I'd like to do is take a look at the plan-specific programs, look at the grid. As you know, every year the Aetna puts together a grid that lists the different programs, and then you go down the columns and look at all the benefits and how they're structured. The general comment I'm going to make, I want to just make sure that there's an understanding that when we do this from year to year, my goal is to get you some valuable information. We can do this a couple different ways this year. We can do it over the phone. I'm more than happy to meet you as well. I'm not opposed to that. We can come to the office. I can come to you. I'm very, very careful with all that. I'll bring a mask, whatever we will do to try to keep you safe. I'm not concerned with that at all. However, if you're not comfortable with that, there's alternate things we can do. We can do a phone call. If you want to use a computer, we can do maybe even a Zoom call or something like that. Okay, so now we're going to take a look at the specifics for the grid. I have the Allegheny County grid up now, and you can take a look as I talk through it. You can see by the grid, they still have probably the plan that you're currently on. The question is, do you keep it or do you do something else? And this whole question comes into what is the basis of your decision? I'm going to make it, what I usually tell people is be very careful what you do. The amount of money that you spend on your premium doesn't mean that you're going to get a superior plan. Okay, that's the first thing I want you to think about. What you pay doesn't necessarily mean you're going to get more. However, this year Aetna has done a very good job. Most of their plans are very inexpensive. If you look on this grid, they don't have anything over $40. The most expensive program is $39 a month. I'm going to highlight one plan. I'm going to talk to you about the Medicare Premier Plus program. It's $29 a month. You'll see it as the third plan over in that column. But before I do that, that's a PPO. So I'm going to discuss with you the difference between the HMO and the PPO just as a review. The easiest way for me to explain it is the HMO and PPO define the networks. HMO, the network is defined by Aetna. You go to their doctors and their hospitals. They have to accept the coverage. That being said, in Western Pennsylvania, the network is extensive. You will have every hospital in Western Pennsylvania that you can go to, up to Erie, down into West Virginia, into Cleveland a little bit. You can go to Cleveland Clinic in network. So it's a very strong network. However, if you want to go out of the network and you have an HMO, it's not going to happen. The only exception is emergency only. The PPO, however, will allow you to go out of the network. The easiest way to explain it is you're just going to pay more. There's a deductible, and then you'll pay a percentage until you get to the out-of-pocket maximum. And next year they've raised the out-of-pocket maximum from $10,000 to $11,300. So it will be a little bit different for you. If you use the PPO with the intention of going out of network, it could cost you more money. But by design, that's how the PPO is set up. And for the most part, I don't see that to be an issue. Most people are not doing that with their Medicare program unless something serious happens and then you decide, you know what, I want to go to MD Anderson or I want to go to John Hopkins or something like that. So on the outside chance that you want that capability, then my recommendation is that you do look at the PPO as an option for you to choose. So that being said, I'm going to look at, you can see what happens here. The $29 plan has a $500 deductible if you're going to use the out-of-network services. So you're not paying that deductible if you're going to a doctor that's in the network or if you're going to a hospital in the network. Let's talk about the out-of-pocket maximum. You can see on this policy it's $4,900, which is one of the lowest available right now for 2021. You can see some of the other programs go as high as $7,550, which Medicare has allowed that to increase from what it is this year at $6,700. So I tell people be very careful about the out-of-pocket maximum. That's not really a barometer as to why you should take the plan, with one exception. If you're dealing with something significantly, for example, you're on chemotherapy, or if you're on an infusion drug or something that you know is very costly, then we want to look at that out-of-pocket maximum, and that would be something that would impact our decision. So if I go into this program a little bit more, I go to the next columns, we get into these details with the hospital stay, the outpatient surgery. You can go down the column and see those copays. They're very competitive. This product is going to be very good for you if you decide that you want to pay a premium. Obviously, I tell people the zero premium program that they have is, a lot of people take that policy, and that's very competitive as well. So you have to go back and forth and decide, what you're comfortable with. The PCP doctor is a zero specialist $35 copay, and you can see that I'm going down the list here. X-rays $20, MRIs, CAT scans up to $250, lab services no cost, routine eye exam no cost, and then I'm going to get into some of the benefits that people ask me all the time about. So there's an allowance for glasses, $300 a year. You have to use the iMed network. So remember, when you get the glasses, make sure you're using the right channel and go to the iMed participating doctors and suppliers. The hearing benefit, there's a zero copay for the exam, and they have towards hearing aids, there's a $1,250 allowance towards hearing aids for each year. So that's $2,500. That's also a very strong benefit. I think it's, you can see across the board, it's on almost every policy. So they've carried that through from this year, and they know that that's a benefit that people were very interested in. Some additional copays that are of interest: physical therapy and occupational therapy, it's $25 copay. The fitness benefit is Silver Snakers as always, and I think I mentioned it earlier, a lot of people find value in that. I think it is a very good benefit. It's just a little bit tougher this year because of what's going on. They also have added additional benefit, help during COVID-19 public health emergency. That's something that I mentioned earlier also. I just wanted to highlight it again, that they decided that it's actually on the grid. They wanted to put it on there black and white so you could see it and have no concerns about it. Meals, if you're admitted to a hospital and it says for over a 7-day period. However, I've had people go have a 3-day admittance and they still got this benefit. Basically what it is they'll give you 14 home delivered meals to help you get back to regular life. It's a very good benefit. I find it, it's appreciated. I mean, it's a way to help you. Nurse advice hotline we talked about. The over-the-counter benefit is a benefit that I think is very well received also. Remember, it's for CVS brand products, and it's an online benefit. You get a catalog. It's not necessarily online, but you get a catalog, and you can do it online, and you can do it over the phone as well, and you call in. This year, they've changed it a little bit. You have $120 for a 3-month period, and you can use that in one shot or use it in multiple shots. Transportation benefit continues also. Some people are it's very important to them so they can get to the doctor, do blood work, things like that if they can't drive. There's 18 one-way trips, and that can be very helpful to certain people. So that summarizes the benefits. And what I tell people is when we're looking at these and evaluating what policy you should take from year to year, it's not all about the premium. If you're on another policy with a different premium, it might be a little bit higher. You have to ask yourself, what is the difference? Does it make sense to make the change or not? I tell people it's the time to change if you want, but you shouldn't change just because you can. That's an important distinction. But I'm available to go over this in further detail for you, and I recommend that if you're not comfortable, we at least have a conversation. I'm here to help you, and I want to make sure that you get the information you need so that you're ready for next year's policy to take care of your needs the best that you can. Ultimately, the changes for this year have been very nominal. The $29 policy for next year was a little bit more expensive this year, but the core benefits are very similar, and ultimately you're going to make a decision that best suits your needs based upon how you think your health factors come into play. Well, I gave you a lot of information. It was some changes in what's going on with Aetna, and also you may have some personal things that you have questions about. I want you to feel free to be able to contact me. I would like to give you my new phone numbers in case you don't have them. The new office number is 724-575-7628. And again, that office has been there over a year, almost a year and a half, but some people I'm finding still don't have that number. So I want to thank everybody for taking the time out of your day to do this and get the information. The other thing I wanted to remind you is you're going to be talking to a lot of people about your Medicare and things you like and don't like about your current policy. That's very normal this time of year. Feel free to tell your friends to contact me as well. I'll be more than happy to help you with that and help them solve that problem, because it can be frustrating. It can be a very stressful situation. I want to make sure that if you can help somebody else get through that, I'm here to do that as well. It's one of the best compliments you can pay me, by the way, because you're comfortable enough to refer your friend to me after I'd already helped you. Thanks again, and have a great day.